Hello everybody, my name is Dr. Arnhold from Germany. I'm a urologist and oncologist and developed many ideas which I could fulfill with the help of our pharmacist, Mr. Rosen, to have a better effect on therapeutic approaches to cancer patients and patients with benign diseases. In this time, the last 20 years, I think we developed a lot of concepts which we brought out of the small town of Königstein to the whole world. With many conferences, I remember hundreds of them, which I did all over the world. And my colleagues worldwide have a good chance to extend their therapeutic approaches with all the products from the Burg Pharmacy.
Hello, my name is Uwe-Bernd Rosen. Thank you, Dr. Arnold, for my introduction. I'm a pharmacist here in Königstein in Germany, and I know him since 1996. Some years ago he came to me and said, well, I mean, we should have an infusion system for turmeric or curcumin, and I said to him, well, I mean, this is not possible because you have a complete water insoluble substance. And he said, well, you're the pharmacist, it's your job. So I said, okay, it's my job. And in 2012, we had developed this infusion for this curcumin for infusion purpose, so we have it patented since then. And in the meantime, the last 6 years, we have developed much more products out of nature substances that can be transformed for infusion purpose, so that products that can now be administered by oncologists and those people who want to make complementary medicine. This gives the patients a chance to get more therapeutic options.
Yeah, in my daily work, I see every day that these drugs Mr. Rosen produces on a high quality base are enabling me to get a better response rate in the treatment of different diseases, and even in the combination with the classic chemotherapeutic drugs, we put them on a better response level to have a benefit for our patients.
You see that the German drug law is one of the hardest laws in the world concerning drug administration and drug development. So we are a pharmacy that has a clean room facility, especially for these products. We have a lot of analytics, and our German authorities, they look after us and control everything so that we can say that we are on a real industrial level.
I think it's very important to point out that we have a so-called network with many colleagues worldwide. They use our ideas, they use it for their daily work, they get response to us, they show us how they are able to work successful with the products, and this is really amazing to see that it's worldwide working with all these therapeutic schedules we use here and we use in other countries, in Asia, in Africa, and even in China now and Thailand. So I'm very proud of that.
So if you imagine that only 5% of the plants in the nature are really researched, we have 95% that are not on research up to now, so we have a lot of tasks for the future to do and develop new medications. But on the other hand, it does not make any sense to develop substances that have no study behind. To have a study is very important, and that we can see that there will be an efficiency for the patient and there will be a chance for a better therapy.
For me, it's also amazing and unbelievable to see how much daily response we get from all the countries worldwide, and how the colleagues ask me about new ideas, having integrated them in their therapeutic concepts. And this is the reason why we come to Australia now, because our colleagues in Australia, they worked with us a very long time. We did not have any possibility to visit them, so we are very proud to come to your country.
That's true.
So we wish our partners in therapeutics and our clinics worldwide success in their endeavors on a successful therapy, and we are able to support you with anything we can every day. Questions, problems, side effects, whatever happens in this time when you work with your patients. And that's what I want to mention at the end.
And if there is any question, any pharmaceutical problem, any question for side effects and every new idea, so don't hesitate to give to us. And I'm looking forward to a fruitful discussion with you when we are there.